I would like to conclude this session and hand over the mic to Dr. Meghna Wagmare.
Thank you. Good afternoon to all the respected dignitaries, distinguished guests, esteemed speakers, and fellow participants present here today. I, Dr. Meghna Wagmare, feel privileged to stand before you as the coordinator of this session. We were thrilled to witness such enthusiastic participants and a highly learned audience gathered to deepen their understanding of this significant topic. I extend my humble gratitude to the organizing team of Sushrutee 2024 for giving me the opportunity to host an event that delves into the profound world of Ayurvedic gynecology and obstetrics. We now move towards the session for today. Today's seminar topic is how can we start IVF center? Aims to bring to light on various aspects associated with IVF center, thereby sparking thoughtful discussions and stimulating new ideas. We are fortunate to have with us today a distinguished speaker who has a lioness contribution in the field of Srirok Prasuti Tantra. His invaluable expertise and insights will indeed make our exploration of the seminar topic a fruitful and enriching experiences. Moving ahead with the session, I would like to invite respected Dr. Madhura Kulkarni ma'am and Dr. Manjusha Meshram ma'am on the stage to chair this session. Dr. Madhura Kulkarni ma'am. She is the director of Arogya Dham at Thane and 30 years of experience at Arogya Dham Ayurved Hospital. And Dr. Manjusha Meshram ma'am. She is the assistant professor OBGY at GSC Nanded. Thank you, ma'am. I would like to invite our today's esteemed guest speaker, respected Dr. Madhur Hamine sir, on the stage. Thank you, sir. Now, I would like to request Dr. Priyanka Nikam ma'am to present the bouquet to welcome our first chairperson of this session, Dr. Madhura Kulkarni ma'am. Also, I request Dr. Priyanka Nikam ma'am to present a bouquet to welcome Dr. Manjusha Meshram ma'am. Thank you, ma'am. I would like to request Dr. Madhura Kulkarni ma'am to welcome our guest speaker, Dr. Madhur Hamine sir, with a floral bouquet. Thank you, ma'am. Today, we have the privilege of being in the presence of a true visionary and leader in the field of obstetrics and gynecology. Our guest speaker has years of experience in IVF business consultation. Dr. Madhur Hamine sir is presently working as a director of USPIA ART Gamete Services Private Limited. He has completed his BMS from DMM Ayurved Mahavidyalaya, Yavatmal. Thereafter, he completed MBA from ICFAI University, Dehradun in Hospital and Hospital Care Facilities Administration or Management. Adding to all these, Sir has many qualities like managing, staffing, budgeting, expansion strategies, growth strategies. He has worked at many renowned hospitals like Rao Hospital, Coimbatore, Vikram Hospital, SureTech Hospital. Really, we are fortunate to have such dynamic speaker with us today. Now, without any further delay, I would like to request our honorable speaker to start his session.
I hope everybody had wonderful lunch, and I hope nobody is feeling sleepy. So, can I request people who are sitting at the back side, can they come forward, please? This is going to be very casual talk. Can you please come so that I will not put my much strain on my vocal cords? Thank you. Thank you. Okay. Thank you, everyone. Thank you, Nima Obgy Society, for inviting me to talk, interact with all of you. मैं सबसे पहले बताना चाहता हूँ कि मैं खुद आयुर्वेदिक ग्रेजुएट हूँ. So I am one of you. After saying that, I have also done my MBA, and last 15-16 years, I am into IVF business consulting. And I have helped almost more than 100 IVF centers across India to start their centers and to take them forward in terms of, clinical outcomes, business development, how to operate. In all these verticals, I have helped them. So without further ado, I would like to start my topic. Can we have next slide, please? मैं करता हूँ. So let us understand the fertility landscape. And all of us know that fertility is a burning issue. And earlier it was considered that it is limited to the urban areas, but now we have understood that it is not only limited to urban area, but it is also in the rural area. So most of us who are practicing in tier 3, tier 4 cities, they may be coming across such cases, whether you are mentioning on your board or letterhead, whether you are practicing infertility or not, whether you are doing advertising or not, 30% of your practice is obviously infertility. So these are simple demographics, which you can see that approximately 3 crore, that is every year 3 crore population is available as infertile patient. Another thing is level 2 ART clinics are around 4,000 to 4,500 in India. Approximately, if you see the entire infertile population, the percentage of infertile population getting into IVF center and doing IVF cycle is hardly 2%. That is very minimal. And then in terms of business, it is valued as approximately 800 crore with a CAGR of 17 to 80%. इसका मतलब ये है कि ये हर साल कंपाउंड ग्रोथ रेट जो है वो 18%, which is so wonderful that that the lot of infertile patients are going to be available across India, and because of the patient education system what we are inculcating in the society, patients are becoming more aware. So they are going to approach to the right gynecologist or ART consultant. So out of all these IVF cycles, currently we are doing approximately 3 to 3.5 lakh IVF cycle per year across India. Out of these IVF cycles, 70% are happening in 8 metro cities of India, and that is that shows that approximately 98% of the population is not reaching to IVF proper IVF center to perform IVF. Next slide, please. I mean, see, we can talk on these issues, but since morning, I believe that you are, listening to all this, what are the reasons for infertility rise and all. Next slide, please. See, this is very important. Fortunately, I am associated with many IVF centers across India, and there is a gradual shift gradual shift towards the holistic approach. There are IVF centers, those who are engaging their patients into systems like yoga, diet, naturotherapy. I can give you one example. A center in Pune. In that center, the patients are referred to Ayurvedic gynecologist for Uttar Basti in case of thin endometrium, and they are getting fantastic results. So eventually, what I can understand is even the IVF consultants are understanding the importance of holistic approach, and they are also engaging the patients on lot of complementary therapies. So, and of course, Ayurveda understands the interconnectedness of mind, body, and spirit. Now, most of the modern medicine will teach you how to treat the body, but we all understand that how to treat the mind as well as the spirit. So, if you combine all these things, the outcomes of the patients are much better. And also, of course, the woman healthcare understanding is much better in terms of mind, body, and spirit in Ayurveda. Next slide, please. Now, this is very important slide, and with this slide, I will come to my core topic, that can we start IVF center? Can anyone tell me who are these people? Can anyone tell me? Shobit Agrawal, Suresh Soni, Nitish Murdia. आपको मालूम है ये डॉक्टर्स है नहीं है? हाँ? So next tab. Yeah. So Shobit is CEO of Nova IVF. Suresh Soni is CEO and owner of ART Fertility Clinics. And of course, Nitish Murdia is the owner of Indira IVF. Now, if a non-medical person can start, why can't we? Isn't it? I mean, हमारे पास में सबसे ज़्यादा patient load रहता है infertile couple का. The current statistics says that 80% of infertile patients are seen by Ayush doctors. हम लोग क्या करते हैं? हमारे पैथी में जितना डिस्क्राइब्ड है, प्रिस्क्राइब्ड है, उतना हम लोग ट्रीटमेंट देते हैं, and there is nothing, that is absolutely ethical. But then eventually one stage comes wherein you start referring the cases to an IVF center. And you know what happens when you refer a patient to IVF center. Most of the IVF centers, they may give updates, they may not give updates. But then eventually at the end of patient का satisfaction जो होना है, वो हमारे नज़र के सामने नहीं होता है. Even if the patient is getting pregnant or beta HCG or pregnancy positive, heart rate आता है, cardiac activity आता है, हमारे पास में नहीं होता है. So eventually the credit is taken by, of course, ART consultant. So if they can, why can't we? And why you should start IVF center? As I mentioned, 80% of the patients are seen in India are by family physicians. Most of them they are Ayush doctors. So प्रिंसिपल कंसल्टेंट के पास में पेशेंट का फेथ सबसे ज़्यादा होता है. आप जो बोलोगे वो करेगा. ठीक है. then हमारे में से 50 to 60% population or doctors, they are either practicing in tier 2, tier 3 cities or tier 4 cities, wherein such facility is not available. If the patient is, see, ये मेरा statistics मैंने study किया है कि if you advise 10 patients to go for IVF treatment in some other city, out of 10 patients, only 2 or 1 patient will reach. Because IVF is not the one-day procedure. See, it needs to be, patient needs to be evaluated, patient needs to be treated. ओवुलेशन इंडक्शन होता है 10-12 दिन का, उसके बाद में पिकअप होता है, उसके बाद में नेक्स्ट साइकिल में शायद या फ्रेश साइकिल में वो ट्रांसफ़र करते हैं. सो इट इज़ इम्पॉसिबल for patient to go from tier 3, tier 4 cities to a metro city to avail such treatment facility. And इसमें से 20% सिर्फ जाते हैं IVF center में. So eventually the patient is losing appropriate treatment if needed. I am sure that with Ayurvedic treatment, lot of patients are getting benefited, and we have seen since today morning that there are practicing gynecologists और प्रसूति शास्त्र तज्ञ, उनके पास में अच्छी ट्रीटमेंट से फ़ायदा भी होता है. बट देन दोज पेशेंट्स हु आर रिक्वायरिंग IVF पर से, दे आर मिसिंग आउट ऑन दैट ट्रीटमेंट एंड इवेंचुअली दे रिमेन इनफर्टाइल ओवर देयर लाइफ टाइम. एंड जैसा ये भी बताया मैंने कि पेशेंट हैज़ मोर ट्रस्ट इन यू पीपल, सो ऑब्वियसली प्राइमरी कंसल्टेंट के पास में फेथ ज़्यादा होता है. सो we need to think over this very, very carefully, that how we can incorporate IVF, Ayurveda and treat the patient holistically. Legally, there are so actually IVF चालू करने के लिए, and I am telling you from the stage because I have been partnered with Dr. Dilip Walke. He is a prominent gynecologist and an expert medico-legal consultant from Pune. He was Foxy chairperson for medico-legal ethics. And also I am partnered with Advocate Amit Karkhanis. He is the one who brought this ART law in India. And he is also on Maharashtra State Board of ART and Surrogacy. So I am telling you from the stage that this is the criteria on which, if you see this criteria, you must start IVF center. We will of course see the challenges in starting IVF center afterwards. But if you are seeing 30 to 40 patients every day, predominantly gynec patients, you bound to get approximately 5 to 10 infertile cases in your practice, whether you advertise or not, whether you mention it on your board or not. If you are referring 3 to 6 patients for IVF in a month, then you are a right candidate. If you have 600 to 2,500, now this depends upon what kind of a setup you have. If you have a hospital of your own, you require only 600 square feet. If you don't have hospital, you require approximately 2,500 square feet space. I would urge one more thing to all of you, that whenever you want to start IVF center, connect with the like-minded practitioners in your city or town or area. Come together and start it. मेरा experience ये कहता है कि it is not single person's business. It's a teamwork. You require a team of doctors to come together and start IVF center. Eventually मैं क्या करूँगा उसमें ये भी मैं आपको बताऊँगा, but then at your level, you need to connect with like-minded people or fellow friends who can come together with this vision that you can start. Approximately total investment is around 1 to 1.25 CR. And if you fulfill all these criteria, then you must start your own IVF center. There is no technical lag or technical deficit if you are fulfilling this criteria. You must start, irrespective of any state you are in. ऐसे बोलते हैं कि एलोपैथिक BMS doctors are allowed only in Maharashtra to do practice allopathy. But the model which I am suggesting, in any state of India, we can definitely start. I will give you some examples also. Next slide, please. Now, what should be the approach? If, आपने 4-5 लोगों से बात की, आपके friends से बात किया, and then you are coming together thinking of starting IVF. What should be the approach? See, let us realize, I was talking to a very distinguished person who is working with Indian government for Ayush Ministry. In the afternoon, we were talking, and then we all felt that there is a intense need to do a integration of both the paths. So somewhere we need to understand our limits. Allopath, they need to understand their limits. And if we come together, कहाँ पे IVF चालू होगा, कहाँ पे आयुर्वेद ट्रीटमेंट खत्म होगा, ये हम लोगों को यदि पता है, तो definitely we would be a great, we would have a wonderful IVF center, which will be greatly. In fact, it would complement each other. बहुत सारी ऐसी सिचुएशंस रहती है कि जहाँ पे आयुर्वेद का सहारा लेकर पेशेंट को अच्छे से ट्रीट किया जा सकता है. जैसे मैंने आपको बताया कि थिन एंडोमेट्रियम इज वन ऑफ द एरिया. So all these points I have previously also mentioned. One more thing I would like to emphasize here is education and training. Now, for any certification or taking any experience, most of you are practicing gynecologists. You can't leave your center and go and stay at IVF center for gaining the experience. But then yes, you can, once you start the IVF center, you can take the same kind of experience in your IVF center on your patient, and that is perfectly legal. Second thing is education. Educating the patients also is more important. See, what happens is, आपके यहाँ पे जब patient आता है, तो they come with a fixed mindset कि ये gynecologist है, ये आयुर्वेदिक practitioner है, and there are limitations. But then if you are well equipped with the further education or further steps to be taken in respect to the patient's treatment, then you can educate the patient. Most of us who are practicing in Tier 3, Tier 4 city, there is a great problem of patient education also. So you need to take such steps. And of course, the partnerships can be brought in afterwards. Now, this is a typical IVF layout. एक IVF center के लिए 3 सबसे important जगह है. एक andrology, embryology, and IVF OT. You can take the pictures, but I am going to send all these PPTs to all of you on your WhatsApp. So you can have it, you can contact me anytime. But then this is, ये एक यहाँ से सातारा करके जगह है, वहाँ पे हम लोगों ने बनाया है. So these 3 rooms are most important: andrology, embryology, IVF OT. Fortunately for us, in the ART law or ASHRAE guidelines, there is no mention of typical space requirements. So and this is, given my experience of 15-16 years, I have realized that this much of space. Now these 3 rooms are comprising of hardly 350 to 300 square feet. And this is sufficient to start. With a bare minimal space requirement, this is sufficient to start. And rest of the space is designed as per the requirement. IUI room hai, ya waiting consultation room hai, ya recovery room hai. So all these things, I think we can easily find this much of space in any of your clinic or hospital or anywhere. Next slide, please. Now, what are the challenges? I think day before yesterday, we had a workshop and I asked many of the students that are they aware of the new ART law? Of course, we are going to have a legal panel discussion about ART law afterwards, after this talk. But then ART and Surrogacy Act 2021 prohibits Ayurvedic doctor to start, to adopt to or to perform egg pickups or embryo transfers and embryology procedures. Can we do it legally? No. ART Act prohibits this. But मुझे एक बात बताइए, पेशेंट आपके पास ज़्यादा है, आप सिर्फ रेफर ही करते रहोगे या अपना खुद का चालू करोगे, एंड यू कैन ऑलवेज टेक, सी मोस्ट ऑफ द आयुर्वेदिक गायनेकोलॉजिस्ट इन पुणे और महाराष्ट्र, व्हाट दे आर डूइंग इज, see there are certain things which are not mentioned in the act. They are cesarean section, normal deliveries, they can do TL also. Only thing is एक्ट में मेंशन किया है एमटीपी, एक्ट में मेंशन किया, इसका मतलब ये है क्या कि वहाँ पे वो एमटीपी नहीं करते उनके हॉस्पिटल में? ऐसा नहीं है. सो व्हाट दे डू इज they take help of obviously there will be a backup surgeon or allopath who will be coming to their center, so they do everything on their name. And if legally you are sound in terms of licensing pro forma, then you can very well perform it. Technological adaptation का थोड़ा सा टाइम लगता है, but then I am sure I will give you one example that most of the Pune gynecologists, all of you, would know a doctor called Dr. Asi Targade. Asi Targade practices in Chakand. It is 30 kilometers away from Pune. He is an Ayurvedic graduate. He did his PG, Prasuti. He has roaring practice in Chakand. 2 years before, he came to me and asked me that whether we can start IVF center. And because of his thought process, we were so convinced that he can definitely handle that. Currently, he is doing approximately 10 to 15 cycles every month. He has IVF center, his own IVF center. Now, इसमें ना बहुत सारी सर्जिकल प्रोसीजर्स जो रहती है ना, most of it is mechanical. Okay? I mean, we might have come across some instances जहाँ पे हम लोगों को मालूम है कि सर्जन का एक असिस्टेंट था, 10वीं फेल था, वो देख देख के सर्जरी भी सीख गया. सर जब नहीं रहते हैं तो वो सर्जरी करता है. इट्स मैकेनिकल, एनीबडी कैन डू इट. सो डॉक्टर असी तरगड़े knows the subject. He have understood the procedures. He can do everything on the under the sun. Only thing is technically we are supporting him. So टेक्नोलॉजिकल एडाप्टेशन ये धीरे धीरे ही होगा, बट ये आपके चांसेस ये है कि दो तरीके से हो सकता है. एक बाहर जाके हो सकता है, नहीं तो आप खुद का सेंटर चालू करो, वहां पे हो जाएगा. रेगुलेटरी हर्डल्स दैट वी विल हैंडल. आई विल टेल यू व्हाट वी डू एग्जैक्टली. पेशेंट अवेयरनेस, फाइनेंशियल इन्वेस्टमेंट, इफ दीज challenges, if you are ready to overcome, and I am sure that most of us who can come together in numbers of 4 to 5, we can easily pull in this investment. And if you have number of patients, we should start it. There's nothing which will stop you. So we are there for you. If you overcome these challenges, we're definitely there for you. Next slide, please. Who are we? So our company is called as Oosphere ART Gamete Services Private Limited. It is based in Pune. We have a head office in Aund. We are 4 directors and 1 legal advisor. Dr. Dilip is there, myself, Mayura, Subodh, and Advocate Amit Karkani. So Dr. Dilip is going to be present here. I mean, he is already here. He is going to be in the panel discussion also. And then, apart from all these 4, we have around 30 to 40 ART consultants and 30-40 embryologists with us. Most of our ART consultants are like, some of them are national faculties in ART. Some of them, they are having minimum 7 to 8 years of experience in ART. Most of our embryologists are either PhDs or having more than 7-8 years of experience in embryology. And with this team, currently we are working with 16 to 17 IVF centers across India. And another 25 to 30 are in pipeline, which will be commissioned in this financial year. So this is what we do. If we are with you, or you think that you should start it, then we are with you to help you throughout your entire journey. How we do it? In fact, ours is the only company in India which is not only into equipment selling. Our approach towards the entire business is very, very scientific. So we work in 3 phases. हम लोग पहले ये देखते हैं phase 1 में कि whether you should start or not. Now tomorrow if someone comes to me, I'll tell them that I need to study your feasibility, whether it is financial or market wise, do a market analysis. Once that is done, then we create a business model कि कैसा करना चाहिए करना हम लोगों ने देयर आर इंस्टेंसेस जब हम लोगों ने एलोपैथ गायनेकोलॉजिस्ट को बताया कि आप यू शुड नॉट एंटर इनटू दिस बिजनेस because the feasibility was not matching, their attitude was not matching, they were having little less patients. So we of course gave them the idea that how you can increase the patients, but then at that level only we tell you that whether it should be done or not. Then in the same phase, we help you in designing the lab. We have architects on board. We do the entire turnkey level project. So we design the lab, detailed designing is done. Our architects are healthcare architects. Those are experts in designing these labs. Phase 2, we do a modular lab and equipment supply. I would tell you one thing about our equipment supply. Actually, because I'm into this business since almost 15, 16 years. Over a period of all these years, I have learned certain things. सबसे important है clinical outcome. If your clinical outcome are better, then you will prosper. So to bring good clinical outcome, we need to choose right kind of equipments. And as we are not only equipment seller, most of the equipment sellers, they will earn their margins from that only. So what we have done is we have negotiated with the companies, manufacturers directly, and we are passing on that benefit to you people so that you will not invest more into unnecessary equipments. Dusra, most of the equipment should be operationally efficient. Most of the अभी क्या होता है कि आप शायद आप में नहीं होता होगा, पर most of the gynecologists, those who want to start IVF center, they'll approach to their friends or known embryologist, and then eventually जो embryologist बताएगा वही लेंगे. So equipment needs to be next generation equipment. At the same time, it should be operationally efficient also. Operationally efficient का मतलब है कि उसको चलाने में कम खर्चा आना चाहिए. So that is, then we will enter into phase 3, wherein we do give ART embryology support, ART medical legal advisory, documentation, and of course the marketing and training support. So what you need to do is you sit, continue doing your practice. You see infertile patients as we have given the formats or documentation in that format, and then our team will be always there to support you on day-to-day basis. बहुत बार ऐसा भी होता है कि पेशेंट ओपीडी में आया है, कुछ प्रॉब्लम लग रहा है, डॉक्टर कॉल आवर ART कंसल्टेंट डायरेक्टली, ऐसा पेशेंट है क्या करूँ, so she advises or he advises. So this is how we function. Next slide please. So these are our advantages. I have already told you. Please next slide. One good thing during this Nima interaction I have learned that we are going to start Usphere and Nima. We are going to take this initiative together. We are going to start certificate course in fertility management for all Ayush doctors, and the duration would be 10 to 12 days. Mode would be online, and topics right from anatomy to anatomy physiology to ICSI level तक हम लोग करेंगे. And syllabus would be, and we would like to invite stalwarts in Ayurveda also to be part of this as a faculty, so that we will develop that holistic approach towards the entire thing. And after doing this certification course, we'll be conducting an offline session for all these doctors who have completed this certificate course of 7 days. We have centers across India, so obviously you can choose the center which is nearby you, and you can definitely go there and study. Thank you very much. Thank you, Nima. I hope any questions are there. I can welcome them, but I think we have paucity of time. I am going to send all these PPTs to all of you on your WhatsApp. If you happen to have any question, any query, you can always come back to me. Please save my number as my IVF center, so that it should be your IVF center. The person who is helping you should be me. Thank you very much.
Thank you so much, sir, for this wonderful informative session. Now, I would like to request Dr. Manjusha Mishram ma'am to felicitate our guest speaker with memento and certificate as a token of respect and appreciation.
Thank you, sir. Such a complex subject in a simplified manner. Thank you very much.
I hope my thoughts have reached them correctly, and you can call me anytime. I'm going to tell you can collect my business card also anytime. Thank you.
Thank you, sir. Now I request Dr. Kalpana Aire ma'am to felicitate the chairperson with memento and certificate as a token of love.
I kindly request our chairperson to felicitate our master of the ceremony to Dr. Meghna Vagmare.